Hello to all. Today we are going to talk about stroke management in Ayurveda with Dr. RAGAVENDRAN. Doctor, please tell us, how is stroke narrated in Ayurveda?
Yeah, see, the stroke is otherwise called as paralysis in a common language. It has been very well narrated in Ayurveda as Pakshaghadam. It is coming under the Vata Vyadhi, which is very well explained in Ayurveda and which is well managed by Ayurvedic management. Vata Vyadhi means something which is due to the imbalances of Vada. Vada is doing the function of movement. Here in paralysis or the stroke, the patient is losing the movement of one side of the body, either the right hand or right leg, or left side of the body, left hand, left leg. So this is the loss of movement of the body function due to the stroke, which is affecting the brain. In Ayurveda, it is well narrated as Pakshaghada. So Pakshaghada means, Paksha means one side of the body, Ghada means Aghada. There is a loss of movement. So when we are trying to treat this disease, we will be giving more importance to correction of the Vada.
And can you tell us what are the causes of this disease?
Yes, when we talk about the causes of stroke in modern science, they tell it is because of the infract or loss of blood circulation to the brain, the cells. So the brain cells are getting damaged due to the lack of oxygen. Whereas the second type of stroke is hemorrhagic stroke, where there is a bleeding continuously happening to the brain cells, due to which the loss of brain cells are happening. In Ayurveda, we take it as either Kshayaja or Avarnaja. That means there is some loss in the bodily tissues, which is leading to the involvement of Vada or increase of Vada, which is leading to this disease Pakshaghada. Or it is due to the Avarna, or there is a block in the circulation which is creating this disease called as stroke. So here Pakshaghada, when we talk, I have already explained that this is due to Vada. So lot of intake of the food which is increasing the Vada, like potatoes, peas, cauliflower. There are so many diet restrictions we advise for the stroke management. So here these all the cause for increasing the Vada, as well as excessive straining, over exercise, or doing lot of strenuous activities. These all is increasing the Vada nature. So very commonly it is due to the diabetes or increased hypertension. This disease is developed according to modern disease. In Ayurveda, it is due to diet and lifestyle modification.
Can you tell us about the treatment principles and management in Ayurveda?
Yes, when we talk about this Pakshaghada or the stroke, Ayurveda will be able to manage it very well. See, it is depending on the duration of the disease. If it is taken within the 3 months of the stroke, it can be fully cured. We can tell that in Ayurveda also there is a limitation. Many people come to Ayurveda at the last minute after long duration, and then they approach to Ayurveda. Then it becomes difficult. When they come to Ayurveda in the first 3 months or within 1 year, we will be able to manage this stroke very well. So in Ayurveda, we talked already about the increase of Vada, the derangement of Vada, which is leading to this Pakshaghada or the stroke. So the management will be completely on the correction of the Vada or nourishment of Vada. So external treatments like oil application, like Abhyangam we call, or Pilichil, there will be pouring of oil in the body, or Shirodhara, pouring of oil, medicated oil over the forehead, or Navarakili, like the rice poultice massage in the body, Virachanam, the purgation methods, or Vasti, the enema methods, Nasyam, the nasal medication. These all are the common treatment methods which we use externally. When we talk about internal, there are so many decoctions, there are so many tonics, and then internal medicines, the tablets. There are many medicines to rejuvenate the neurological cells in the brain, so that it is well managed, and then the patient can be brought back to their normal life if it is approached. Along with Ayurveda treatment, I usually recommend to have the physiotherapy session. In modern medicine, they will be giving only the initial management of the emergency, and then they will be advising to go for only physiotherapy. The difference is In Ayurveda, we call it as that the body gets stiffened when the stroke is happening. So it is due to Vada. The Vada management is by oil application and sudation, Snehana and Svedana. So the body becomes more softened, and then when we do the physiotherapy along with the internal medication and the external treatment, it is very well managed and the patient can be brought back to their normal life.
So how can this disease be prevented in Ayurveda?
Yes, as we talked about the causes of Pakshagada or the stroke, in modern they consider it due to the uncontrolled diabetes, uncontrolled hypertension. The lifestyle diseases are more cause for creating the stroke according to the modern. In Ayurveda, we talk about the increase of Vada, the diet or our activities which is increasing the Vada nature has to be very well managed. So in my opinion, the patient who are having diabetes or hypertension, they should be having their diseases well in control, as well as they should be very careful about their diet and lifestyle. So this lifestyle modification, when they have a healthy diet, when they have the healthy lifestyle, proper exercise, so these all things will be very helpful in preventing the stroke. As well as very commonly nowadays stress is one of the main factor. So patients will have a lot of stress, psychological problems, so emotional imbalance. So it will also lead to the increase of the blood pressure, and then anytime the stroke can happen. So stress management by yoga methods. So oil application, maybe weekly, one day the patient can have the whole body oil application, which is very well narrated in Ayurveda. These all are the very common principal methods to prevent the stroke to not to happen.
As mentioned by Dr. RAGAVENDRAN, in order to stay away from having any chances of having a stroke, it's important to have a proper lifestyle, a proper diet, to manage the stress correctly, and to have regular oleation over the body. That way, strokes can maybe be avoided. Thank you very much, Dr. RAGAVENDRAN.
Thank you.
SG Ayurveda Hospital and Research Institute, Periyanaikapalayam, Coimbatore.